Hi, my name's Holly. Welcome back to 5-Minute Birth Classes. Today we are talking about the Fetal Anatomy Scan. This is also called the Anatomy Scan, the 20-week scan, the FAS. You usually get a referral form for this once you've had good results from your 12-week scan, and it's booked for about 20 weeks. So usually between 19 and 21 is when ultrasound places are happy to book them. The receptionist will ask you like a due date and a couple of questions just to make sure that they're booking it at the optimal time for you and your baby. So the anatomy scan checks out quite a few things. Everyone thinks, oh, that's where I get to figure out if my baby's a boy or a girl. Not actually the point of the scan. That's just an additional bonus if your baby is playing the game that day. So the anatomy scan is a really big one. It takes usually about 45 minutes to do. Now they look at baby, number one, so that is head to toe on baby. They make sure everything is growing and developing appropriately and it's in the right place. They also look at the level of fluid around baby. They look at where the placenta is. Now obviously the placenta can be anywhere like within the oval of your uterus. So if it's anterior or at the front, then you might find that your baby movements aren't really felt until about maybe 22 weeks. If it's at the back, you might not really feel any movements kind of towards that area. If it's low down near your cervix, then sometimes it could be overlapping or completely covering the cervix, and that requires like additional checkups and scans later on in pregnancy, especially if you're aiming for a vaginal birth. They look at the blood flow through the placenta and the umbilical cord. That's a really important bit. They also look and see where the umbilical cord inserts into the placenta. So just like a tree over roots, it can be like in the middle or it can be like off to the side a little bit. So that's actually good to know. They also look to see what your cervix is like at 20 weeks. Now this is a reasonably recent addition to the anatomy scan. And what's really cool is that the Preterm Birth Prevention Project is a global initiative, and I'll do a deep dive on this one day. And it was developed by obstetricians and researchers here in WA at King Eddie's. How cool is that? So a few years ago, there was a Professor John Newman, who was doing some research and realised that some of the people that were having their babies really early actually had a really short cervix at the 20-week scan. So there's been extra research done into that, and now we know that if your cervix is under 2 centimetres or 20 millimetres at the 20-week scan, then your risk of having a baby before 36 weeks is about 10 times higher than normal. Really cool research. So that's another measurement that's taken. Now, as I said before, this scan usually takes about 45 minutes. Sometimes baby is like really showing off, and you know, get in and out within 30 minutes. Sometimes babies are just refusing to roll over, to move, to like let the sonographer access whatever angle that they need to finish the scan, in which case you might be asked to drink heaps of water or go for a walk, do some squats, and in the event that they can't get the scan finished that day, they will get you to make an appointment to return like within a week or two to complete the scan. It does happen reasonably often. It's not super common, but it does happen. So just be aware of that, and that's totally normal. Now, if there's anything really abnormal on the scan that needs to be actioned or reviewed immediately, they will usually ask for your doctor's details or your midwife's details, and contact them while you're still there, and make sure that there is a plan for like urgent review, and they'll also push the results of that scan through so that the report can be viewed and kind of discussed with you ASAP. Have a great day.